2020, your projection for a contraction this year earlier was about negative 2.9%. Then I think you met in July with the DBCC, and as projected here in the BESF, you're projecting a contraction this year of 4.5 to 5.5%. Is that correct? Or
Correct,
4.5 to
correct.
6. Yes. Okay.
That is correct. Thank you.
Okay. But we all know that the first half of this year was 9%, because the second
-9,
quarter
yes.
was 16.5. And based on your presentations, people are not able to get back to work. And we all know that. And then we had another quarantine. We're almost done with the third quarter. It's almost impossible that we will end up with a negative 4.5% this year, isn't it? We're probably closer to -8, -9, -10.
Well, Mr. Chair, so admittedly, when we had the 2 weeks MECQ, we are pushing actually the numbers towards the -6.6. But last week, when the labor force survey came out, it suggests that the economy responds quickly to the policy that we have in place. So, for instance, the unemployment, which hit 17.7% in the second quarter during ECQ, improved significantly by around 85%, down to 10%. In the third quarter. So it really depends on the policy stance that we put. And so long as we do not have a U-turn, we have a gradual recovery and relaxation, and the confidence continues to build, then I think the range is still possible. But as I mentioned, this is a period of uncertainty. So the moment we see changes in the monthly data, we will do the revision. But so far, the U-turns are all going up.
Yes, we understand that. But the question now is there a downside risk of projecting a better economic outlook? Wala bang downside risk yan?
Well, the risks
So
are
far as
there.
preparing the budget, yes.
Yeah, well, the risks are there, and this budget operates for now on the up to -6.6% contraction. Now, if there is a significant change in the GDP, then the budget, of course, will have to be recalibrated, and that is why we are proposing a phase and adaptive approach, because this is really unprecedented uncertainty. So we'll have to be more flexible as needed.
Yeah. Okay, we'll leave it at that, Secretary. But thank you for your response. Yeah.
Thank you.
Just another question. I looked at the BESF, and next year we will be able to collect roughly what, a little less than 3 trillion. Secretary Carl or Secretary Dominguez? Anyone?
What is G?
Perhaps DOS Secretary Dominguez.
Hi, Secretary Dominguez. Yes.
Hi, Mr. Senator. Yes.
Yes.
We gave our projections, and it's going to be less than 3 trillion.
Okay. And I noticed that we will be borrowing roughly 3 trillion next year as well. Is that correct?
Yes.
So, and in fact, we will be borrowing more than what we will be able to raise in revenue.
Yes. Because we have some debts to retire.
Correct. Yeah. The first being, of course, the reduction in revenue, and you project a deficit, and of course, you increase the budget for next year, which I support, and therefore the deficit is roughly about 1.75 trillion.
Yes.
Okay.
That's correct.
Okay, and we will be borrowing 3 trillion. Okay. A part of that we will pay principal payments.
Principal, yes.
And we're building our cash.
Yes.
Okay.
Yes.
Now, do we have? I've not seen here in the BESF what is our expected cash balance by January 1?
We don't usually reveal that, Mr. Senator.
Yeah, but every year
we can provide that on a confidential basis to the Senate President.
Okay, thank you for that. It will be important. Now, the change in cash is a little more than 500 billion. Okay.
Yes.
Okay. Now, the question is, the question I will have is that why are we only spending if we will have an additional cash of 500 plus billion, why did we only allocate 2.5 billion for vaccine? I'm just following up from the question raised
For
by
what?
Senator for vaccines.
Because the funding for the vaccine can come from a loan, and it won't impact the budget.
Okay. No, having said that, again, this is a law, no, and I understand where you're coming from, Secretary. But there is no item in the budget. Let's say, why not include an item for vaccines in the unprogrammed fund?
We don't know exactly how much is going to be required or when it's going to be required, but we are prepared at this point in time to provide funding for the purchase of vaccine outside of the budget.
Outside of the budget,
Yes, so that will be paid in future budgets, 2022, 2023, 2024.
I don't know if you can do that, Mr. Secretary, because you need
Yes, we can.
you need an appropriations cover.
Well, we can do it because it's going to be funded by our GFIs, not to a government agency, but to our PITC, who will then provide it to the DOH. And when we know the amount, that will be the payment of that will be budgeted after
But
after the purchase.
okay, question. But there is a budget of 2.5 billion, isn't it, in the GAA for next year in the NEP?
Yes, I believe that's the amount.
Yes. And how many should we cover for the 2.5 billion?
I beg your pardon?
How many of the population are we covering with 2.5 billion?
I don't know exactly, but what my understanding is around 1,000 pesos per person. Around 1,000 pesos.
Okay. So if it's 2.5 billion, then just 2.5 million people at 1,000 pesos.
Yes.
Okay. Now, if it isn't it that they are saying that you need to vaccinate at least 60% of the population?
Yeah, Mr. Senator, I am not an expert on vaccines or pandemics. That one you have to ask the DOH. We were asked, as I mentioned to Senator Ontiveros, we were asked to prepare around 20 billion pesos to acquire vaccines for I don't know the exact number of people, maybe 20 million. So that one you'll have to address it to the DOH. We just got their number and we're preparing to fund that.
Yes. No, the reason why I ask this question is because according to the WHO, you need to vaccinate roughly 60% of the population. And at 1,000 pesos each, that's 60 billion. Now, my position is that I think we should appropriate this in the 2020 budget under the unprogrammed fund. At least may nakatabi na doon na budget cover authorizing the executive to spend on the vaccine for roughly 60 million. I just wanted to put that on record, Secretary. Okay?
Thank you.
So thank you very much for the response. Huh? So maybe the question is more appropriate to the DBM Secretary as well. No, there is also a budget for next year, and most of these questions now are in relation to health because, as mentioned by our minority leader earlier, that the most important is to breed confidence. No, and if they see that we are putting everything that we can, halimbawa for vaccines and assisting our frontliners, our health care institutions, improving them, no, to address this pandemic, then magkakatiwala yung mga tao. That's the idea here, Mr. Secretary, no, Mr. Chairman. So in the budget, there's also an amount of 2.7 billion for PPEs for next year. Would that be enough for next year, Secretary Abisado?
Honestly, Your Honor, there's nothing enough at this point in time, given the various requirements that we need to respond to. But certainly, we're also guided by just how much can we spend and utilize for next year.
Correct.
So it's a very difficult balance of how to allocate all of these funds and
No,
we
we
made available,
understand.
Your Honor.
We understand. And that's why we in Congress, we're asking these questions, right? Okay.
Yeah.
And this is what is being presented. 2.5 billion for vaccines. I know that there's 10 billion in the Bayanihan too, under a program, okay, which makes it 12.5, right? Okay, now, for PPE, how much have we spent under Bayanihan 1? Under Bayanihan 1 for PPEs?
Bayan
Ayaw
yan.
natin. And then plus may Bayanihan 2 pa. So may budget.
Wala pa ho. Wala pa ho kasi hindi pa napipirmahan.
Hindi, pero
Kapag napirmahan po, tuloy-tuloy lang po.
may amount
Opo.
for PPEs, no?
Bayanihan man. One lang. We'll get back to that
Okay, no? Yes.
to you
And the reason
on that
why I asked
later.
that, you might want to review kung tama ba tong 2.7 billion for PPEs for this year, for 2021, no? And then for the testing kits, let me follow up on the point of Senator Villar also earlier. But first, with regard to the budget on the cartridges or supplies for test kits, there is a meager budget also of 1 billion only for test kits for next year. How much have we spent this year for test kits? So, Secretary, let me just make a point. Baka kulang na kulang yung 1 billion for this year also for test kits. Okay? Moving forward, there is also a budget in the Department of Health for 16.58 billion. Okay? For human resources. Will this be enough to cover the salaries of the additional health workers for next year, including the bonuses and all of that for our frontliners?
Your Honor, that's in line with HRH,
Yes.
and it will cover at least 26,000 doctors, nurses, and other health workers, Your Honor.
Okay.
26,000. Yeah.
Okay. For the whole year na to, it will be enough.
Yes, Your Honor.
Okay.
Yes,
Thank
Your
you for
Honor.
that. Okay. We will not be hiring any additional. This 26,000 is the same that we have today.
At the moment, Your Honor, we still don't have a report from DOH whether they've run short of the funds that we've given to them for purposes of hiring additional healthcare workers, Your Honor.
Okay. Thank you very much. Moving forward, under the social services, Mr. Secretary, what is the status of our SAP-2? I know that the DBM has released the money to DSWD, but from our reports on the ground, hindi pa nabibigay lahat nung SAP-2. My understanding is na bigyan lang yung 3.5 billion families who were not part of SAP-1. Okay? So they got their entire SAP, but yung balances until today, they failed to provide it to the recipients, Mr. Secretary.
Yeah, we have provided all that's needed for both first and second tranches for SAP to DSWD, Your Honor. We have yet to know the the strategy that they did for SAP2, because except for the fact that they have reported to us that for SAP1, their utilization rate has reached out to 98.6%, and for SAP2, 94.8%. But the details of which I think can be better explained by Secretary Bautista once his budget is presented, Your Honor.
Okay, thank you for that. Anyway, we will look into those figures that you presented,
Yes.
Secretary. Okay. Mr. Chairman, I have no further questions for the moment. I know many will be asking. The points I just wanted to raise is that one, most important is that we must show our public that we are serious in fighting this pandemic, and considering that we will be borrowing roughly 3 trillion next year, there should be enough funds for vaccines, for PPEs, for testing kits, for quarantine centers, so on and so forth. No. Similarly, noting that poverty incidents may escalate, unemployment has gone up to 10%. It's also possible that the contraction will be more severe than what we are expecting, and that feeds into itself, Mr. Chairman. No? And having said that, and that's why it's more important not to spend to show the public that we are allocating for health. One question on the health, Secretary, which I forgot. No, on the health facilities enhancement program, pala. There is a budget, I think, here of roughly about 16 billion also. Okay. Now, that may be very much inadequate also. If we're willing to spend 1 trillion, let's say, for build, why not also do build for our local health or hospitals? Because there's nothing in the budget, incidentally, that increases any of our bed capacity at the local level, district, provincial, or regional hospitals. Walang increase in bed capacity. Okay, so I just wanted to point that out, Secretary. Yes, Secretary.
Yeah.
Yes.
Yes, Your Honor, under HPEP, which has a total proposed budget of 11.6 billion, it includes about 4.7 billion under DOH's budget, 5.5 under a program for construction of primary healthcare facilities under HPEP, and 0.91 billion for isolation facilities. This is through program loan from ADB, and another 0.34 billion for isolation facilities funded by the World Bank, and another 0.14 billion quarantine facilities, again funded by the World Bank. So there are in fact efforts to precisely address the capability of the government or the DOH in putting up all of these isolation facilities, including the primary health care facilities under HPEP, Your Honor.
Yes, Secretary. All I'm saying is that today the situation of our healthcare is very poor, especially at the provinces, Mr. Secretary. That's what we're trying to point out here, and we realize this even more today that we are under a pandemic. Okay, now we know that this will last maybe until there's a vaccine. Okay, and hopefully the strain that hit us is not as strong as those that hit Western Europe or, let's say, America. And maybe we're a little more resilient as a people. We're lucky on that, Mr. Secretary. But our eyes are now open that we need to make more investments in our healthcare infrastructure. Okay? If we are willing to spend 1 trillion pesos in capital outlays, why not include a part of that for building, improving the increasing bed capacities in our local hospitals? Hindi lang palagay ko, hindi lang puro kalsada ang kailangan natin ngayon. Hindi lang puro tulay ang kailangan natin ngayon. There is also equally a multiplier effect in building the hospitals. as part of your capital outlay. So
Yeah. I certainly agree with you, Your Honor. Matter of fact, my experience with the LGUs is that the effort to trace, treat, and isolate is a very big issue at the shoulders of the local government units, because while they endeavor to really be stronger in their efforts on tracing, once they've traced them and they found out to be uh, part of the virus that is spread out, they need to have isolation facilities, and they should not be allowed to go home because just the same,
yes,
there be carriers already, and therefore isolation facilities are very important. And then when they are uh, tested, with all the more reason that whether they're positive or not, until the result comes out, they still have to stay in the isolation facilities. And that therefore the need really are isolation facilities and more efforts on contact tracing. That is to that on the preventive aspect, aside from the treatment, which would require increase in the bed capacities of hospitals
yes, yes.
and accrediting other hospitals for that matter. And that's really what is the situation on the ground, Your Honor.
Yes, thank you for that, Secretary. So, well, thank you for the opportunity to our chairman, Chairman Sonny. Thank you.